everybody. Thanks for taking time out of your afternoon to join us for the McSilver Institute's first brown bag lunchtime lecture. And I'm thrilled to introduce Kathy Wu to you. Kathy has been a diversity postdoctoral fellow and assistant professor at the school since fall of 2012. 11. That's right, this is at the beginning of 13, fall of 2011, so a year and a half now. She comes to us from the University of California, Berkeley, where she earned her PhD, and she worked under two fantastic mentors, maybe more, but two whom I know. Michael Austin, who's nothing less than a giant in organizational studies and social work, and Julian Chow, who's a good friend and colleague of mine, who's an absolutely brilliant statistician, GIS expert, and also very committed and dedicated to work with minority communities. So Kathy's been really interested in, and she came to the McSilver Institute to pursue her interest in access for of social services by cultural and ethnic minority populations. And today, this relates to her talk title today, Multi-Level Influences on Ethnic Minority Service Use, Implications for Mental Health Service Delivery. So I'm really thrilled to bring you the McSilver NYU postdoc diversity fellow who is giving this first lunchtime lecture, Kathy Wu.
Thank you so much for coming, spending your afternoon here. I see a lot of familiar faces, students, so thank you very much. I wanted to say a special thank you to the McSilver Institute for Poverty and Policy Research for inviting me, really giving me this opportunity to introduce myself to people who don't really know me, give a little bit of background for people who do already know me, and just to give you an opportunity, to give me an opportunity to talk about what the heck I've been doing here for the past year and a half. So I really appreciate you coming to this brown bag. And in the spirit of the brown bag, I really hope to engage in some discussions and questions towards the end of my talk, and hopefully there will be time for that. Okay. So just to give you an overview of what I'll be talking about today, I'm going to try not to move because the camera is supposed to be right here on me. So if I move, just guide me back. But to give you an overview about what I'll be talking about today, first I'll go over my research inspiration and interest. Then I'll talk about some of my current research and scholarship that I've been working on here, and finally some future directions that I'd like to move towards in the future. So just to give you a little bit of background about me, my research interest really stems from my personal background, which has shaped my work in the community, which has also informed my research. My family fled Vietnam as boat people in the late 1970s, and we landed in a refugee camp in Indonesia before we came to the U.S. That's me, that baby. And the tiny woman there is my mother, who's still tiny. So this is a picture of my parents and I in Indonesia with some of the people that my dad worked with. When we finally came to the U.S., we relied greatly on the programs and services of organizations, social service organizations and charities, and that were provided by, we landed in San Francisco, by the way, so California, San Francisco, and we really benefited from the services that were provided to immigrants and refugees at that time. For example, a church group helped us to apply for food stamps and welfare. There are organizations that provided my parents with English language classes, job placement, and housing resources. And so these organizations really provided us with the financial and material support to literally pull ourselves up from our bootstraps. But despite these supports, my family still struggled initially from migration trauma, family separation, and other types of mental health issues that were not adequately or appropriately addressed by the services that were available at the time, because in San Francisco at the time there were very small populations of Vietnamese refugees and immigrants. There was a lot of Chinese people around, but not really a lot of Vietnamese people around. So the experiences that I had growing up in an immigrant family and utilizing these services has really shaped my work and my interest in community-based organizations that serve ethnic minority clients. So my research aim really focuses on three main areas. First, it's to build organizational capacity to serve ethnic minority populations. I'm interested in questions like, how can organizations deliver services to ethnic minority populations that are appropriate and effective? How can organizations do a better job at engaging ethnic minority populations? Answering questions like these are related to my aim of reducing service use disparities among ethnic groups. So significant service use disparities exist among ethnic groups across all service sectors, and I'm interested in developing and evaluating evidence-based macro interventions to reduce these disparities. And finally, related to these aims is my interest in understanding the relationship between organizations and their environments. So as social workers, we usually emphasize the person in the environment when assessing our clients, when providing services to our clients. But I would also argue that it's also important to assess organizations in their environments, because that's where social work practice is delivered. We all work in organizations. We all deliver services from organizations, and clients come to organizations to receive services. So it's important to understand the organization as well as the context in which the organization is located. So, why focus on ethnic minorities? Ethnic minorities are growing at a very rapid rate. Between 2000 and 2010, ethnic minorities grew so the 2010 census shows that non-Hispanic whites, while they're still numerically the largest number and the biggest proportion in the United States, grew a lot slower than other ethnic groups. So for example, African Americans, the proportion of African Americans increased by 12%, over 12%. Hispanics and Asians by 42% in the last decade. That's amazing. And so these populations are growing in the United States, and along with their growth, there are also higher poverty rates for ethnic minorities. So ethnic minorities are disproportionately represented in poverty, by people in poverty. So, for instance, in 2011, there were about 10% of non-Hispanic whites who lived in poverty, while almost 28% of African Americans, 25% of Hispanics, and 12% of Asians. So they disproportionately represent those among poverty in relation to the size of their population in the U.S. So despite evidence that suggests that ethnic minorities have high human service needs, service use disparities exist across ethnic groups. Literature on human service human service use across sectors suggests that ethnic minorities are generally overrepresented in public social services. So services that are required, like criminal justice or child welfare or TANF. They're overrepresented in those public social services, but underrepresented in voluntary services like mental health or health, where they go based on need, not necessarily because the government calls them to. The disparities may be due to a number of different barriers, including institutional, organizational, and personal and cultural barriers. Institutional barriers include the service delivery systems that may be complicated or confusing for to navigate for ethnic minorities, particularly immigrants who don't know English or are new to the country. In terms of organizational barriers, they may not have the resources to provide services in culturally competent, in a culturally competent manner. And personal and cultural languages, again, related to the individual's background. They might not have the language skills to utilize services, therefore preventing them from wanting to access them. Service use disparities can be addressed by nonprofit community-based organizations. So these organizations are different from mainstream organizations that provide. These types of community-based organizations are different from government organizations like counties or states that provide social services to general populations. Community-based organizations, or CBOs as I'll be calling them, are usually located in the communities they serve, so they can be more easily accessible to the clients who use their services. Because they're located in the communities they serve, they're usually more familiar with the barriers and the needs of the service users and can better understand how to address them. CBOs also try to integrate into the community by providing a range of activities and programs that foster a sense of group identity and social supports that make social service use more appealing to people who may not or cannot utilize them. So they make them more attractive. CBOs can also be gathering places that are familiar and safe for service users. So conceptualizing ethnic minority service delivery. We usually talk about cultural competence in the form of a model clinician relationship. And cultural competence can also be applied to an organizational framework. And that's really, this framework is what I really use to guide my work and inform my studies. An organizational, cultural competence at the organizational level expands the scope of the clinician-patient relationship to include organization and the community. So organizational cultural competence recognizes the role of the context of the location of the organization, as well as the patient-clinician relationship. So here, I talk that there's the community context, which provides a background for understanding the dynamics of the community. So for instance, organizations are usually located in counties, which are nested in states and larger federal entities. So it's important to understand the dynamics between the organization and those local and state and federal policies. The cultural characteristics of local populations, that's really where is this organization located? Is it located in an area of high ethnic minority populations? Is it located in a diverse area? What are the socioeconomic indicators around these organizations? And how does that influence the way organizations provide services? In terms of organizational infrastructure, organizations must have the capacity to address the needs of ethnic minority populations. So for example, if an organization primarily is located in an area with a lot of Latinos and Hispanics who speak Spanish, they should be able to have the capacity to serve those clients either through staff who are knowledgeable with the culture and customs, and also to provide language services as well. And then the direct service domain really talks about integrating the cultural customs and practices into the service provision. So talking more about the client and the clinician relationship. So there's several research gaps that exist in the literature. Mainly most of these studies that apply the organizational cultural competence framework focuses on individual aspects, individual domains of the model. So scholars So for example, scholars of ethnic minority service delivery generally agree that ethnic-specific services or services that are tailored to a minority population can provide positive outcomes. That's really been a lot of work done by David Takeuchi and Stanley Su and colleagues, finding that ethnic-specific services can increase treatment length, can decrease no-show rates, those types of outcomes. But another body of literature suggests that, the relationship between human service organizations and local social demographic characteristics appear to have some sort of relationship, but it's contradictory. So, for example, the location of nonprofits can usually be put into domains as resources, based on resources and based on needs. So some of the literature said, okay, organizations locate in areas where there are high needs, because that's where the service users are. Other studies indicate that organizations locate in areas of high resources, which tend to be wealthy suburbs that don't necessarily have access, that don't necessarily serve poor ethnic minority clients. So there's sort of a disconnect in the research in that way. And primarily, I think it's because that they look at just those things separately. They look at the context, or they look at the organization. They don't look at the context and the organization in combination with one another. So despite the extensive literature on ethnic minority service use, it's still unclear about how the combination of these factors, these organizational and these community factors, will influence minority use in conjunction with one another. So to address these research gaps, I propose using a multi-level model approach to better understand ethnic minority service use. A multi-level model approach allows us to look at the different domains of ethnic minority service use in combination with one another. It also gives us a more holistic view of the relationships between each of these domains with one another, and can clarify some of the contradictions in the research. This approach is really the basis for my dissertation while I was at UC Berkeley. Excuse me. My dissertation focused on community and organizational factors associated with ethnic minority use. It was funded by the United States Department of Housing and Urban Development and the Max Center on Nonprofit Management and Human Services. The main research question really was, what community and organizational factors are associated with ethnic minority service use? So the data came from the Los Angeles Nonprofit Human Service Survey collected by the Center for Civil Society of UCLA. Organizations included in the survey study population were gathered from a number of different databases and stratified and using a stratified random sample that included about 6,850 organizations. A sample of 1,334 were selected based on income and location to make sure that there was representation across the county. 1-hour telephone interviews were conducted, and 707 interviews were completed for a response rate of 53%. So this is the organizational data. This is where this survey asked about staff and ethnicity of staff and clients, and a lot of different types of organizational questions. I merged this data with the Los Angeles County's census data, to create a two-level model, a two-level data set that had organizational data and indicators of socio-demographic indicators from the census. So the two-level data sets, where organizations were nested in zip codes. So if you think about the community, the basic unit of analysis, basic unit of analysis is the organization, and the organizations are located in communities. So this is why I created this two-level data set. I used GIS to create maps that shows organizations in relation to their zip code demographics. And the maps only have zip codes where one or more organizations located, so within the sample. So if there is one or more organization located in the zip code, those are the zip codes that I took a look at. I also used hierarchical linear modeling to analyze the two-level random intercept model to assess the relationship between contextual demographic data and organizational characteristics. In this part of the study, again, the level 1 data, or the organizational data, comes from the Los Angeles data set, and level 2 data comes from the zip codes. The merged data set yielded a total of 360 organizations with 167 zip codes that had complete responses. Excuse me. So based on the literature, my conceptual model, this is my conceptual model that I used for the dissertation. And my conceptual model depicts direct positive relationships between both organizational factors and community factors. I analyzed 4 different models, one for each of the major ethnic groups. So there was African American, Hispanic, White, and Asian Pacific Islanders. The dependent variable was the percentage of clients served by each ethnic, for each ethnic group. I operationalized the community factors by ethnic minority concentration, by ethnic groups, and by poverty levels, by ethnic minority poverty levels. In terms of the organizational factors, I looked at board staff, ethnicity of the board and staff, whether or not the organization provided services in languages other than English, and the staff size. The language was measured so it's hard to explain without a drawing for it, but each of the dependent variables each of the models was ethnic specific. So for example, African Americans, the percent of African Americans utilizing services across all organizations was, that model, African American board members, percentage of African American board members, percentage of African American staff members. And then multilingual services was measured in the dichotomous variable, yes or no. And staff size was measured using quintiles, and I'll talk a little bit about that in a bit. So my theory was that organizations that had high percentages of ethnic-specific board and staff members that provided services in languages other than English and had higher staff size, and that were also located in high ethnic minority zip codes and high poverty zip codes with high poverty rates would serve higher ethnic minority clients. That's really based on the literature and based on my own personal research that I had done previously. So this is just another way of looking at the variables. Here I divided the organizational variables, level 1 variables, ethnic board, staff, services, language services, and staff size, and then the minority concentration and poverty level at the level 2. Dependent variable, again, is the percentage of ethnic clients, ethnic-specific clients served. So this table presents some sample characteristics. Here you see the clients who were Hispanic make up the largest population of the sample, so at 35%. The highest proportion of ethnic board and staff members were actually white, despite the fact that white clients were, well, second highest, made up the second largest group in the clients in the sample. Some of the numbers may not add up because the other group was excluded. So this slide shows the sample characteristics of some more sample characteristics of the organization. Over 3/4 of the sample provided languages, services in languages other than English. Because large range of staff sizes among the agencies, I divided the staff sizes into quintiles. So for example, if you think of this as super extra large, 84 plus staff members, and then this category is sort of large, medium, small, and extra small. That's how these variables were measured. And actually, in the literature, the average small organization has 29 staff members. So you can see here from the sample that the majority of organizations in the sample were small, were categorized as small because they had less than 29 staff members. So these are some sample characteristics of the zip codes. So again, there are 167 zip codes in the sample. The average number of organizations per zip code was 2. So that's pretty small. And I'll talk a little bit about that later. The percentage of zip codes with one organization, with at least one organization, was 43%. About 41% had 2 or more organizations in them. And then the percentage of zip codes with 4 or more organizations were 15. So not a lot of zip codes had a lot of organizations within them. There's some socio-demographic characteristics of these zip codes. So here I present the percentages for Los Angeles County in 2000. This is 2000 data. The survey was conducted in 2002, so 2000 data, census data was the most relevant. And the majority of the sample, the majority of zip codes had Hispanic residents, right? So it's 41% of the zip codes had Hispanic residents. So in terms of where are these organizations located with respect to their socio-demographic characteristics? You can see here by this map that the largest, this is the ethnic minority composition of zip codes with organizations in the data set. Does that make sense? Yeah. Okay. So the highest concentrations of ethnic minority groups are located here in in central and south central Los Angeles. And these dots are actually the organization, zip codes that have one or more organizations in those zip codes. Poverty concentration, very similar. Central Los Angeles County has very high concentrations of poverty, and you can see that there are organizations there. I'll talk a little bit about the dots later, and you can ask some questions. So some of the findings of the models that I ran. So I used data to fit 4 different models, as I said, one for each of the major ethnic groups. And so for brevity's sake, I only present the ones that are significant. So the significance of ethnic-specific board and staff members for all 4 groups, African American, whites, Hispanics, and APIs, or Asian and Pacific Islanders, was significant. So, so this suggests that for every ethnic group, the percentage of clients that use services would increase if there was the presence of ethnic board staff, the board and staff members. The provision for services in languages other than English was negative for the white population and positive for the API organizations. So API serving agencies. So in other words, white clients are more likely to go to organizations that provide services only in English. So that's an interesting finding. This could be due to a number of different reasons. It could be that organizations used by white clients primarily serve non-English speaking groups. It could also be that white clients do not live close to or have access to agencies that provide provide services in more than one language. As for API clients, they are more likely, the data show that they're more likely to use services from organizations that provide languages other than English, and that would make sense if they provided Asian languages. But unfortunately, we can't tell that by the data, because it wasn't included, which is a limitation of the study. Interestingly, language was not significant for Hispanic clients. And given that many of the Hispanics who live in Los Angeles County are immigrants, the lack of significance might be, for this variable warrants further investigation. I expected that staff size would be significant for all groups, because the more people who are available to serve people, the more likely people are going to use services. But this didn't seem to be the case. And I'll talk a little bit more about this in the limitations section as well. In terms of the zip code characteristics, these three coefficients here for African American and white clients, the coefficients suggest that organizations that are located in areas where there are high Hispanics and high APIs, so mainly immigrant areas, are less likely to serve African American and white clients. And this could have, the negative association can have several explanations. It could be that organizations located in primarily immigrant areas serve primarily immigrant groups, and therefore don't really provide services that African Americans or white clients would need or could easily access. Given the social and demographic disparities of Los Angeles County, it could be that organizations located in this area are not welcoming or appealing to non-English speakers. English-only speakers, I'm sorry. So if we think about a clinic in Chinatown where the sign is Chinese and the services are Chinese and it's located in a Chinese area and the staff and everyone speaks Chinese, that would be less, it might be uncomfortable for someone who doesn't speak Chinese to go access services there. But it would be comfortable for a Chinese person to go access services there. And so that's indicated by, that's reflected in this positive association here in API clients utilizing services from zip codes that have high API concentrations. This coefficient here, poverty in African American, suggests that African Americans are more likely to utilize services from organizations that are located in high poverty areas, which contradicts prior research from my mentor, more or less, Julian Chow, who found that ethnic service utilization is more likely to occur in non-poverty areas. So this is an interesting finding, contradictory finding to what was previously found in the literature. So for HLM models, usually we report the row, and I reported the row, which is also known as the intra-class correlation and the R-square. And the intra-class correlation for African Americans, Hispanics, and APIs are 0 or close to 0, which means that there's not enough variation at the zip code level to use a multi-level model. Basically, what this says is that using a linear model would predict the same thing as using a multi-level model for these three ethnic groups. Whereas white, it was appropriate to use the two-level model. The large R squares overall suggest that the variables in the model are good predictors of service use for these ethnic groups. So just to summarize those findings, just to summarize the findings, across all ethnic groups, ethnic representation on the board and staff of organizations reflect the ethnicities of the clients, and that was significant. So that's important for ethnic minority service use. The provision of languages and services in languages other than English was negatively associated for white clients and positively associated for API clients. And the staff size was not a significant predictor for any of the ethnic groups. In terms of zip code findings, the location in ethnic minority zip codes matter. In terms of service use for African Americans, whites, and APIs, there's a negative association for African Americans and whites, and a positive association for APIs, based mainly on location in immigrant populations. And the location in poverty zip codes was significantly associated with African American service use. Okay, so limitations. There are several limitations to the study. First, the inherent constraints that exist in using secondary data analysis. So those who have not had the pleasure of using secondary data to do analysis, you'll find that there are many joys to it. One of which is dealing with response bias, so that respondents may incorrectly mark an answer or what have you, which may skew data and findings. The one that I struggled with the most was the availability of relevant and appropriate variables. So there were a lot of variables that I would have liked to have, but weren't available. For example, I didn't have the names of the organizations, so I didn't know where they were located. So I didn't know, and I didn't have any client data, so I couldn't match the client data to the organizational data to see like access issues or things like that. So that was pretty difficult. Despite being stratified and randomly selected, the small sample size of the organizational data set may have also contributed to the results of the study. So the response rate was 53%, which is above what is found in other typical organizational studies. But it's relatively low to social sciences. So that might have contributed to some of the findings of the data. And there was also a significant amount of missing data that some of which was addressed by a single imputation, but despite that, there was still a significant amount that was missing. So it reduced the number of organizations that I could use in the model. The study took place in Los Angeles County, which is a really large and diverse county, and so it's generalizable only to places like that. And finally, the conceptual model for the study really looks at the very straightforward, simple, and direct relationships between community and organizational factors. When I was a doctoral student, I was trying to learn all of these things, and I was really young and naive back then. So I didn't know. I didn't think more of more complex relationships. And since I've been here, I've been older and wiser, and I've been open to the powers of structural equation modeling. So I've really been trying to use that to expand the conceptual model and just to look at more complex interactions between the variables. But despite the limitations of the study, the findings presented here provide approximate answers to the initial questions that I'm really interested in, and have really helped me to focus the work that I've been doing here that builds on the disagreement. So in terms of implications, excuse me, in terms of policy implications, across all ethnic groups, ethnic representation on the board and staff of organizations that reflect the ethnicity of the clients was significant. So this finding highlights the importance of training and recruiting ethnic minority populations to be workers in these types of organizations. So policymakers could and should consider providing financial incentives to train and recruit appropriate ethnic minority staff members. In terms of practice, human service organizations should consider the local community characteristics of residents when working with specific organizations. So if you're an organization and you're trying to target a specific ethnic group, the local demographics matter. Cultural characteristics should also be taken into consideration. So for example, So for example, in terms of, for example, Asian groups, they tend to, a lot of Asian groups tend to present, don't talk about mental health issues because of the stigma related around it, because of a number of different reasons. So instead of saying I have depression, they present with psychosomatic symptoms, and they go to their primary care physician to talk about these symptoms. And so those types of things should be considered in delivering services to ethnic minority populations. And finally, findings suggest that one size does not fit all. So an organization can't necessarily provide, can't necessarily engage all ethnic groups at once. So if you're really wanting to do something like that, you should look at different models of service delivery that may provide insight on how to better serve ethnic minority populations. Okay, so my current research builds on some of the findings of the dissertation and takes into consideration the limitations that and implications that I just outlined. I wanted to focus on the findings for the Asian group, particularly because that's where my research interests have been. Because I'm an Asian refugee, and also because Asians are one of the fastest growing groups in the United States, and I'll talk a little bit about what that means in New York City. So, from a macro perspective, I really want to focus on Asian American populations. I want to focus on mental health service use because the dissertation really looked at service use across sectors. It didn't look at specific service use, so across human service sectors. And so now I really wanted to focus on a specific service sector, which is mental health. And I wanted to apply the organizational cultural competence framework and ethnic organizations literature to study Asian American mental health service use. So I just want to go over ethnic organizations a little bit. There's a large body of literature on ethnic minority service use that focuses on ethnic organizations. And these organizations are those that provide services to specific ethnic groups. They're usually identified by having the name of the ethnic group in their name or in their mission statement. And ethnic organizations don't exclude other ethnic groups from their service delivery programs, but they definitely provide cultural activities and focus on a particular ethnic population. Some of the characteristics of ethnic organizations include the fact that they generally serve ethnic clients. The staff consists of a majority of individuals who are the same ethnicity of the clients they serve. They have ethnic majority on their board, and they include ethnic content in their programs and services. And by doing so, they really, the studies on ethnic organizations have shown that they really uphold and foster ethnic identity as a result. Because of the similar ethnic backgrounds of staff and clients, staff are better able to relate to clients with whom they work. Clients tend to feel more comfortable seeking help from staff who understand their culture and language. And so this is to contrast with mainstream organizations. Mainstream organizations are those that provide services to the general population. And they don't particularly focus on ethnic groups, so the sense of cohesion may not be as prevalent in a mainstream organization as it would be in an ethnic organization. Mainstream organizations also serve primarily geographic areas and may focus on socioeconomic status of the region, but not take into account the ethnicity of residents when considering the location of their agencies. In my own research, I found that ethnic organizations have the capacity to foster the ethnic group's cohesiveness and identity through their focus on culture and language. I've also worked in an ethnic organization, When I was after I graduated from the MSW program, I worked on in an agency called McSilver Community Services that provides mental health services to Vietnamese immigrants and refugees. And what I experienced there was really reflective of the literature. McSilver is located in an area in San Jose, California, which is an area, a city with a high proportion of Vietnamese in a neighborhood that was predominantly Vietnamese. They were small. They had a full-time staff of 4. They relied mainly on part-time clinicians and volunteers. And at the time I was working there, they were formally providing services to about 100 clients or so. But the number of people who actually came and utilized the building and came for non-billable services was much higher than that. So in the literature and in my own experience, I think that ethnic organizations are really important and effective in delivering services, mental health services to populations. But my hypothesis is that these are usually small organizations and they're usually struggling. And even though they do really great work, they don't have the capacity to serve the people who actually need the services. And so it's sort of a problem, and we need to do more. We need to do more so that we can build the capacity of these smaller ethnic organizations. So earlier I talked about why we should study ethnic minority populations. Now I'm going to talk about why we should study Asian populations in particular. As I noted earlier, the Asian population grew faster than was one of the fastest major ethnic groups in the United States. Grew at a rate of 43.3% in the past decade. By 2050, the Asian population is projected to grow by 41 million people. And so that would represent 9% of the total U.S. population. In New York City, Queens is home to more than 49% of all Asians. And there are currently 7 neighborhoods where Asians make up the majority of the residents in New York City. 5 of those neighborhoods are in Queens. They include Flushing East, Jackson Heights, Elmhurst, and Jamaica Hills. The literature on Asian mental health service use suggests that despite a high need of mental health services, they generally have low rates of use, but this varies based on generational differences. Mental illness, again, we talked about earlier, is not generally discussed in Asian culture since there is a stigma associated with it. So for many older Asian immigrants, instead of talking about mental health issues that they face, Asians usually present with, again, psychosomatic symptoms, and then they talk to their doctors about it. Research has shown, though, that mental health service use increases as immigrants are in the U.S. longer. So these groups have service patterns. So second generation immigrants have higher service use than first generation immigrants. But despite these generational differences amongst Asians still use mental health services at a rate that's disproportionate compared to other ethnic groups. So there's among other factors, there's a large need for culturally and age-appropriate mental health services. So now I'll talk about a little bit about what I've been doing since I've been here for the past year and a half. During my first year, Dr. Zui Lin and I have developed a study that takes a multi-level approach, specifically looking at mental health services for Asian Americans. Dr. Nguyen is really interested in older Asian adults. I have an organizational interest in Asian mental health service data, so our interests are really complementary. So we combined our expertise to look at the multi-level dimensions of Asian mental health service use. And we applied for and received the faculty seed grant from the McSilver School, as well as funding from the Okura Mental Health Scholarship from CSWB. Our community research partners, Korean Community Services of Metropolitan New York, or KCS for short. KCS is an ethnic organization whose mission is to develop and deliver a broad range of social services to the Korean community. Dr. Nguyen and I were particularly interested in having KCS as a research partner for several reasons. As I mentioned earlier, over half of the Asian population, over half of all Asians in New York City live in Queens, so it's a great place to study dense Asian populations. KCS also has two very active senior centers, one located in Flushing and the other one located in Corona. And they're located in very different neighborhoods. The Flushing one is located in an area of high densities of Koreans, and then the Corona one is located in densely populated Hispanic areas. They have different organizational histories, and they have different cultures, both in terms of the people who provide the services there and the people who come in for services. So for me, really, it's like studying two siblings from the same family who have very different personalities. In addition, KCS has been going through a lot of different changes. Based on the needs of their older adult clients, KCS has recently applied for a license to become a mental health clinic in New York State. So they are also interested in learning about mental health barriers. So given Dr. Nguyen's interest and my interest in the needs of KCS, we've been able to form a really strong working relationship with them. So we're almost, is this right, Mary? Yeah. Okay. Okay. All right, so we have three specific aims for the study. The first is to understand socio-demographic characteristics of the local community. The second is to assess the organizational individual factors that affect help seeking for mental health conditions for Korean older adults. And the third is to develop a theoretically guided help seeking model based on data from aims 1 and 2, and to assess the relative importance of contextual, organizational, and individual influences on health service use. Here's our conceptual model. It aims to look at the multi-level use, multi-level factors of service of older Asian Korean service use. And again, since I've been here, I've really been trying to look at the more complex relationships. So we're looking at the potential partial mediating factors that might affect service use between that might affect service use. This is some of the methods that we're going to use. Really is going to replicate the macro part of the macro part of this study is going to replicate my dissertation. So we're going to look at socio-demographic factors to contextualize these communities, and then we're going to conduct semi-structured interviews. So we're going to collect our own data so that we can answer the questions that I didn't get to answer, and focus groups with organizational stakeholders and service users. And three, we developed a survey to help understand individual factors and that influence service use. So we have collected, at this point we're wrapping up our data collection and entering it into a database. We're extracting data from the ACS, the American Community Survey, zip code data. We've conducted 5 key informant interviews with stakeholders from multiple levels within the organization. Focus groups, we've had focus groups of 24 participants and surveys, administered surveys of 113 surveys. Us. Both of these were conducted in Korean. So we've really assembled a great team of research assistants to help us conduct this study in Korean. So the surveys and the focus groups were translated and transcribed into Korean. And that's where we're at with this study. I'm sorry I had to go through it so fast. And just some of the other projects that I've been working on. I've been really interested in looking at temporality effects, issues of API organizations in New York City. So with the research assistant, I've been gathering data from the Urban Institute, which houses the largest nonprofit database in the country. and merging that with census data to look over time to see which came first, the community or the organization. And that study is being focused in New York City. I'm also working with McSilver on an evaluation of change implementation. So in New York State, there are clinics that are going through restructuring to basically lose less money. And so some of the clinics have already gone through it and some have not. So what we're doing is evaluating BEAT, which is a learning collaborative that tries to help organizations go through the change process. And organizational responses to healthcare reform. So over the past summer, I had the opportunity to be an emerging scholar at the Urban Institute, where I spent the summer really talking to experts in nonprofits, in health policy, and urban policy about how organizations are responding to healthcare reform. So there I really was able to develop this study in conjunction with their input, and so I was really grateful for that. Future directions. In a nutshell, I really want to look at studying more closely these ethnic organizations. So are there differences in mental health outcomes of services provided by ethnic organizations as opposed to mainstream organizations, and what are those differences? And how can we understand those differences? So basically, which type of organization better serves ethnic minority clients? And a possible funding source could be the NIH Career Development K Award. My acknowledgements, just to thank you for this opportunity. McSilver, Silver, the Urban Institute, CSWD, and thank you for coming.
I know many of us have to go on to our next commitment, but we ask you to stay around and field a couple of questions if you have time. But those of you that have to leave, that have been looking at the clock saying, I have to go to my class, please feel free to do that as well. Yeah. Thank you. Any questions for Kathy?
Yes.
This is very interesting, and I have a question that's held over from when you were talking about your dissertation. And I'm thinking, well, not New York City, but especially Los Angeles. And I'm just wondering about the construct of Asian. And my understanding of LA, limited understanding of LA, even more than New York, has a huge array of populations that are under the Asian umbrella. And I was wondering if the numbers you found, how you think they might have been impacted by the fact that you were not able to use more specific data. For example, if you're interested in Koreans accessing services at a Vietnamese agency, both Asian, but I would expect that that would not be the same pattern as Koreans accessing services at a Korean agency for both cultural and language reasons. And the same thing might apply for Hispanic, although maybe the language may be the same, but not the culture.
So your question.
So the question is, how do you think that because of the data that you used, you weren't able to look at that level, how that might have affected the findings that you had? I mean, for example, was the effect that you found, was that probably depressed from what it would be if you were able to look more specifically?
I think so. I think that, so the way I was able to, so what I was originally hoping to do was a study on ethnic organizations, actually. And I wasn't able to because I didn't have the names, I didn't have the addresses. What I did have was the mission statements of these organizations. And I looked at them, and less than 6% of the organizations included in this data set could be considered ethnic based on their mission statement. So I think the low sample size of the organizations and the types of organizations that weren't, the low sample size, and then my inability to really look at whether or not Asian organizations can serve these different ethnic groups. I didn't have the specific ethnicities of these groups either. So there is a difference between Korean and Vietnamese, you're right. And those differences really do matter. I think that would definitely have changed some of these findings. And then you can also see, I think, that the Asian organizations or the Asian groups, the clients, the board, and the staff, they were relatively small in the sample as well. So that definitely would have affected the findings. Yes.
Hi, Kathy. Thanks for presenting. I appreciate it. I'm a little bit familiar with Los Angeles County.
Probably the data set as well.
I was just wondering about your choice to look at zip codes as opposed to census tracts. And also speaking to what Jim was saying, perhaps something that you might consider moving forward is looking at the ethnic heterogeneity of the community, percentage of, X ethnicity among all the rest, and seeing how that might impact their service, how they're accessing their services, and if they feel comfortable that way.
Right, so then your question is about...
I'm just wondering if you thought about that. First of all, why did you choose zip codes as opposed to census tracts? And then secondly, perhaps you could consider looking at the ethnic heterogeneity of the community, of that census tract, to determine if that is going to impact any differently your findings about the percentage of people accessing a particular ethnic service as opposed to...
So to answer your first question about zip codes, choosing zip codes instead of census tracts, zip codes I felt, well, that was the data that was available, first of all, and then we would have had to do a lot of work in terms of placing those zip codes into census tracts. So we decided against that.
Because it's kind of a nightmare, I know.
Right. It is kind of a nightmare. And in response to your second question about heterogeneity, I think if I'm answering it correctly, you're asking, or if I'm understanding it correctly, you're asking me if I looked at the heterogeneity in Los Angeles County, would the findings be different?
In the particular zip codes, if you're going to use zip codes, or in the census tracts, would they be? What do you think?
Yes, so definitely. So one of the major limitations of the study is that there were an average of 2 organizations per zip code. And that's really too small to look at anything, to make any, to look at very fine-tuned sort of data. And it would affect the results, definitely. So if we had zip codes or larger sort of geographic...
That's what I was thinking in terms of the tracts.
Right. Yeah. If we had larger geographic units that had more variation within the zip codes of the different organizations, we would probably find different.
That's a good question. Thank you very much. One of the findings that's been coming out of critical studies, critical geography studies, and urban studies over the last couple of years is that at very high rates of ethnic minorities are moving out of the neighborhoods in which they've been in. And this is likely mostly linked to the economic downturn. And something that I think would be very fascinating to study is sort of our organizations sort of moving with folks as folks move typically from urban cores and out to the suburbs. So it's I realize a limitation of the data was that the data was sort of cross-sectional. I think it'd be fascinating to track sort of longitudinally how is it that sort of organizations might be moving, because my sense is that as ethnic minorities sort of move out of areas, for example, here in Manhattan, because of the cost of living, organizations typically haven't followed, and I think that has major implications for access to services and utilization of services.
And so that's really what I'm trying to take a look at when I do the New York City Asian serving agencies and the populations. We're trying to look at where they've been moving in the past, over time, so starting in the 1970s, and then to now, and really trying to find, to merge that data with when organizations started popping up. So are the organizations popping up because these people moved to these places, or are they there and the people just moved to the places because of them or for other reasons? Yeah. Thank you for that. Yes.
Kathy, thank you too. I'm wondering if your next steps in your broad look at this issue would be to make a determination, find out whether there's greater utilization of services of people who would be using these ethnically oriented organizations, particularly if they had an opportunity to use another organization that may respond to their services. The second down the road would be to see whether the outcomes are any different.
Right.
Because isn't that what we're looking at ultimately?
Right. So I think that that's a very logical and natural progression, really, to look at service use, the rates of service use of these organizations, and whether the outcomes of the service use are positive or negative. And that's what I was trying to poorly describe in the K award that I'm hoping to write, is to really look at the differences between services provided by an ethnic agency versus a non-ethnic agency, a mainstream agency, and to look at it to see if service use is actually higher in those ethnic agencies, and my hunch is that they are, due to a number of different reasons. And then once we figure that out, then we can look at the service use outcomes as a result. Yes?
Can I ask you a very selfish question? So if you can't answer this, it's just because, it's a hard question that I'm struggling with. Part of what McSilver is very involved in is working with the New York State Office of Mental Health to help organizations weather this huge change of Affordable Care Act, Medicaid redesign. And so the agencies that I assess to be most at risk are the ones that, in terms of really just not being here anymore, are small organizations that serve particularly high poverty communities and serve particular ethnic groups. They are the most vulnerable financially in the new model. Is there any data that you have, either you have or in the literature, that can inform OMH why they potentially should invest in those organizations? Because I think that there's a lot of real potential for the service systems over the next couple of years to really change and these organizations be gone. And so is there any particular data that you would point the policymakers to?
Right, so I think that CTAC has been gathering a lot of great data, actually. And CTAC is the Children's Technical Assistance Center, and it consists of the organizations that have mental health licenses with the state of New York. And so CTAC has, I think CTAC would be a great start to look at the types of organizations that are within CTAC, because it's the whole universe. It's the whole universe of mental health agencies that serve children in New York State. So if we look at that, we can take a look at that type of information and see, and really sort of do a small pilot to connect that data with the financial data that is available at the Urban Institute.
The financial data won't fill us into in terms of outcomes.
Right. Right. So that would be a really great start. The Urban Institute, so the data set that the Urban Institute has mainly financial data, and it has categorized it by, it can be categorized by ethnic group. And so we could also look at that as well. After we look at the pilot for New York State, maybe we can look at broader social health and mental health services in terms of McSilver's interests.
Thank you.
Just had a comment, well, a very brief comment that I'm really pleased that you move on to do mixed methods research so that you can actually, I find it frustrating when people say the limitation is that I don't know really what the down the street community looks like, and your professor should have told you that, but then now you're going and looking at down the street, what is happening on the ground, and you're linking both, and you have the quantitative skills to look and even put together your own survey, and then you are developing the skills to go and ask the questions directly. And I think that's a great future research, and I'm really happy to hear that.
Thank you. I really appreciate that. I think one of the things that I've learned coming here as a postdoc is how much I don't know. I've learned so much since I've been here that I really am trying to apply what I've absorbed at Berkeley and here, and to apply it to the studies that I've been doing here. So I'm really grateful for this opportunity and this time, and for the support and the resources that the school and McSilver have given me. But thank you for that. I'm trying.
Thank you. much, and thank you all. There might be an extra wrap